and ear clip electrodes. So ear clip electrodes use a different methodology. They use something called as cranial electrotherapy stimulation or CES. ये एक नॉन इन्वेजिव ट्रीटमेंट है एंड इट इम्प्रूव सिम्टम्स सच एज एंजाइटी एंड पेन. And this is best applied with ear clip electrodes on your earlobe. और आप बोल सकते हो जहाँ पे इयरिंग्स पहनते हैं वो जगह पे ear clip electrodes को you have to apply. Now, why is ear clip electrodes given? You know, why is it that there was bracelet electrodes, then uh, we we have the ear clip electrodes, and we have the adhesives. So what makes ear clip electrodes different? So let's go a little bit deeper and understand. आपने सुना होगा that we have different brain waves. Have you heard of it? We have different brain waves. So what are the different brain waves? Do you know what are the different brain waves? Do you know what are the different brain waves? Anyone? Yes. Alpha, delta, yes. Correct. Right. So we are remotely aware of this. Great. That's very good. Okay. So here you already, since you know that there is alpha waves, there is something called as delta waves, and there is something called as beta waves, right? Yes, there are other waves also, but here we are only referring to three waves today. That is alpha, delta, and beta. So ये जो alpha waves हैं, alpha waves, what is their job? Let's understand ये काम, what do they do? So the alpha waves, okay, they work in a certain range. In fact, not just alpha waves, everything in our body has a certain range. It has a parameter and things have to work in that parameter. You know, when we look at the cell membrane voltage model, in the very basic of understanding how microcurrent frequency therapy works, we say that minus 70 MV to up to minus 90 MV ke beech mein, when the cells are operating, they can be counted as healthy cells, right? There is a range. Same way, all our organs also have certain dominant frequencies and a possible range that helps them operate in the best way possible. And the same applies also to the alpha, delta, beta, and all the other possible kinds of waves which are there. Okay. Now, alpha waves they have this certain range. I think around between 8 to around 13.9 hertz or so, okay, would be the ideal range for the alpha waves. Now, what does alpha waves do? What is it responsible for? Or rather, why is it important? Okay, well, alpha waves are responsible and connected and associated with a person feeling relaxed, focused, and in good health. For mental coordination, for long-term memory. So memory is also associated with the alpha waves. Creativity, visualization, and associated with light meditation. So when you are getting up after a prayer, okay, every morning I'm sure a lot of us do our own prayers. So when we are getting up from our own prayers, prayers, irrespective of whatever is the right way of prayer or any kind of chanting, basically, how does it make you feel? It makes you feel peaceful, right? Does it not make you feel peaceful? Don't you feel nice? So when you feel nice, you can say it is light meditation. Your focus and coordination is better. So it is activating your alpha waves, or you can say that it is creating a balance at an alpha wave level. Okay. Same way, when you need to create something, if you are in a job which requires a lot of creativity, okay, which requires you to create something, invent something, make something possible, right? So in that case, you need to have a certain kind of focus, you need to have a certain kind of vision, and that is possible again when alpha waves are in the correct range. Okay, when they are in the correct range. Acha. Now, kabhi kabhi dekha hai, have you observed that there are days when you just feel your mental coordination is not good? What I mean to say is that, maybe let's say while going somewhere or while coming from somewhere, you just feel like, you just banged into something. And sometimes we get hurt and we don't realize how did we actually get hurt, right? So that could mean the coordination level is slightly low. So that could also be that is also related with our alpha waves. Okay. So all these areas are very, very important to create a balanced level of focus and coordination for the correct kind of long term memory, for visualization, for creativity, for light meditation, or feeling the calmness inside your mind. Alpha waves balancing is important and should be in the range. We then have the delta waves. So delta waves also has its own range, around 1 to 3.9 hertz जितना. Okay, it has its own range also. I'm just going to show you the chart for the same. Okay, so it also has a certain range, right? So it has a certain range that you can see on my screen. Okay, now delta waves has this range which is also important to be maintained, because it is also connected with multiple areas like, our deep sleep, unconsciousness level, growth hormones which are released, loss of body awareness, deep physical relaxation, access to collective unconscious mind information from there. So it's connected with all of these things. So let's say when the sleep is disturbed in the night, it could easily mean that the delta waves are not, balanced, or are out of sync. Okay, and one thing is connected with the other thing, so automatically when your one certain thing is imbalanced or is out of the range or too much, it's either below or is out of the range, it could automatically mean that some other waves are also disturbed. Then we have the beta waves. Now, beta waves are connected with the left brain thinking. They are associated with stress and anxiety and fear. So, for example, when we have pain, okay? So, for example, when we have pain, and there is, let's say, leg pain, knee pain, back pain, joint pain, different kinds of pain. And over the time, because pain is not getting better, okay, over the time when pain is not getting better, you will see that you are getting stressed out about it. It is constantly playing in your mind that it is hurting, my back is paining, my back is paining, it's constantly coming inside. You are associating things with the pain, you are constantly thinking that the pain is causing you disturbance somewhere, and automatically you will see that there is a occurrence of stress, anxiety, and a reoccurrence of all these things along with fear, right? So, which means that the beta waves are extremely high. They are not in the range of 14 to 30 hertz, but they could be beyond 30, like, maybe higher than 30 also. When it's out of range, also you have a heightened sense of fear, anxiety, and stress. Okay, so automatically things are unsynchronized when these waves are also unsynchronized, and automatically, well, our routine day-to-day jobs get affected. Okay, so what I want you to remember from this page are just two major points here, three major points here. One, for relaxed, for what is important for relaxation and feeling the calmness in mind, alpha wave balancing. Okay, the second point and that we need to remember is that sleep imbalances are associated with the delta imbalances. Physical relaxation upar niche hota hai when delta waves are out of balance. And third is anxiety, fear, stress are associated with the beta waves when they are probably over and high. Okay, is this clear, this much part? Now going ahead, the point here is that when we are working with the ear clip electrode programs, okay, which are called the cranial electrical stimulation programs, it automatically decreases the delta and the beta waves, okay, which are overworking, because of which different pain, fear, anxiety, sleeping imbalances, focus issues are happening. Okay, so in and when delta and beta decreases, there's an increase in the alpha waves also adjoiningly. Okay, so it's a cause and then there is a effect methodology where these two go down and one comes up, so automatically your mental association with pain or the relationship that you are sharing with pain at a psychosomatic level and emotional level sort of softens up quite a lot. Okay, so the increase in the alpha waves contributes to a patient's relaxed mood, feeling focused, feeling more creative, feeling more productive towards their day. Okay, it also does improve how a person is perceiving things and their thinking capacity or cognition. Okay, so Pain Page has these programs that we are using primarily with the ear clip electrodes, which focuses on creating a balance when used directly here at your wave level, where your alpha waves are balanced and harmonized, brought back to its original range. Okay, and alpha waves are big. So let me make it very easy. When alpha is weaker, delta and beta are stronger. That is when alpha is also weaker. So using the ear clip electrode, it focuses on making bringing the delta and beta back to its bracket by, and also improving and increasing the alpha, but again within the bracket. Okay, so that is why ear clip electrodes are very, very, very important. So now the first program that is present on this page is called as the chronic pain program. Now chronic pain program, it's a 20-minute program. Okay, it's a 20-minute program which you can use with the ear clip electrodes. It's a very important program because you can use it for multiple different things. You can use it for any and every kind of pain. It's a 20-minute program. It's very, very easy to use. It's very easy to use. All you have to do is use your ear clip electrodes, remove your earrings if you are wearing your earrings, and place your ear clip electrodes in that particular area. How many times should you use it? Well, try to use it every day once. And once you are getting better, start using it every 2 days or weekly. Okay. Now use low intensity because the area is sensory area and it is quite close to your other sensory organs like your eyes, okay, and yours auditory nerves also. So thoda sa let it be on lower intensity. It's fine. You can just use it on a 10% also. It's fine. Okay. Any uneasiness felt during the program would mean you need to just pause the program. Okay. Now, do not use these programs during fever. Please make a note. Do not use this program or the program page in total during fever. I will repeat in Hindi also. Pain program page ko during fever istemal na kare. Okay. Now the next program is called chronic back pain. This is a very specific program which works on a very, very specific frequency, and it works with adhesive electrodes. It is a flexible program. By flexible program, I mean you can use the program in the area of your pain. So let's say, for example, if you have a left back pain and a right back pain, okay, how are you going to use this program is what I would like to ask you. How will you use this program? Will you use the program with adhesive electrodes, one left on one right? Yes, that is one option for you to use. Second option to use the chronic back pain program is if you have a whole back pain. Then you use the adhesive electrode first on the left side of the back. Stick the electrodes close to each other by leaving around 1 to 2 centimeter gap, 3 centimeter ka gap between both the electrodes. Okay. First, just cover the left side for 20 minutes. After 20 minutes, remove the electrodes and place it on the right side, close to each other. Okay. Leave around 1 centimeter come minimum gap, maximum can be 2 or 3, depends on the placement. Now again, it's a 20-minute program, so you can manage in around 40 minutes. You can complete both of these programs beautifully, and they are very easy to use also. Okay. You can also combine chronic back pain with the chronic pain program that can be used with the ear clip electrodes. So what you can do is you can first start with the chronic pain program and then go on to using the chronic back pain program. So you first use the first 20 minutes with the ear clip electrodes, use the chronic pain program. After that, use the chronic back pain with adhesive electrodes for the specific area. In this way, in the first part of the program, you're first working with your brain waves, your pain sensor, and the pain connectivity towards the brain. Okay. And in the second part, you're working on that area. Okay. This is how we can work with this. Then we have the joints local program. Joints local program. The best way to work with the joints local program is that you can apply it on one joint first. If let's say there are both the knees are hurting. Okay. If both the knees are hurting, you will first apply the joints or the adhesive electrodes on just one joint. Let's say you start with the right leg first. So right leg के आजू बाजू में knees के ऊपर you will apply the adhesive electrodes by keeping 1 to 2 centimeter का gap between both of these. Okay. Okay. And if you are working, and then after this program, go to the next joint. Okay. This is a slightly longer program, but not as much longer as probably our other programs from Healy. So you can say it's yet easy to use. Around 30-minute ka program hai, काफी बढ़िया program hai. You can use it on various different areas: your elbows, your ankle, your knees, your shoulder joint. With frozen shoulder, you can also use it on your shoulder joint. Okay, if your neck joint is hurting, then you can place it on your neck joint. Do not place it on the heart and on the neck here. Okay, but वो छोड़ के आप दूसरे areas में you can use it. You can also ask and buy some bigger sized adhesive electrodes for more larger areas if you have to cover this. Try to use it on low intensity. Any uneasiness that you feel during the session, kindly pause the program, stop the program. Again, do not use it during the fever, please. Now intensity, well, it can be as you are comfortable, but you will see the difference. जैसे कि if you are applying it on the back, around medium intensity is okay, as compared to if you are applying it, let's say on the back of your neck, for example, when you have a neck pain, जैसे कि तो you will see that lower intensity is better because the threshold is different for different areas of the body also. Okay. We then have the next program, which is called as the teeth jaw local program. So this is a dental program, which you can use with adhesive electrode on, for example, here you can apply, here you can apply, here you can apply, here and here. But do not apply here. We do not apply this particular program here. Okay. I'm specifically showing you with the placement because you don't apply it near your eyes. Okay. It's too close to the eyes. We do not apply it near the eyes. The application process is to apply it in this area, in this particular area. Not too close to your mouth and not too close to your eyes, not too close to your nose. Apply it here in this area. Okay. Any feelings of uneasiness, immediately stop the program. Duration is 20 minutes, but the area is sensitive. We are sensitive on our faces. So use extremely low intensity. do not use during the fever. Teeth and jaw local program is for dental based pain, but in areas where you need a root canal or a surgery or an extraction, this cannot replace it. You have to do what you have to do. Okay. We then have the migraine program. Migraine program is a very important program, I believe, because migraine can cause a lot of troubles in various different areas. Okay. The migraine program is to be used with the ear clip electrodes. 20 minutes का program है. You can also change the gel pads of your ear clip electrodes also. Alternatively, if you do not wish to use the ear clip electrodes, you can also apply the round adhesive electrodes on the mastoids that is behind the ear. Okay. Um, Amplitude intensity, the lower the better. Try to not go above 30% or stay lower because the area is pretty sensitive. Okay, any uneasiness, stop the program, do not use during the fever. Now, the migraine program is very, very good. You can combine it with certain programs. So, let's say if you are suffering with migraine and it's been a long term troublesome issue, you can use the migraine program first. You can then go on to using the gastrointestinal program, solar plexus, because you need to ask yourself, is it that there is a BP fluctuation which is causing migraine? Or is it that there is acidity, because of which the migraine is caused? Is it because of over screen time? Is it because the sleeping, you are going through a sleeping disturbances? So you need to ask yourself these few questions. Okay, there's one more important question that you should ask yourself during the migraine, and that is, did I eat my meals on time? Do I keep huge gaps between my meals? So, the answer to these questions will help you understand what you should be using after the migraine program. If the reason is because of tummy issues, then you can combine migraine with the gastrointestinal and solar plexus. Or if not solar plexus, solar chakra, you can just take the head harmony in the bioenergetic harmony page. Okay. If it is during because of the sleep, you can use the relaxed release migraine combination. Okay, or you could just use the release relax, one of the combinations, and you can easily work around.
Trisha ji, you're muted. Trisha ji, excuse me. You're muted. You'll have to repeat a little bit and unmute yourself.
Yeah, okay, I will just repeat myself. I will just immediately repeat myself. So yeah, what the point here is, the important point to note is that when you are suffering with migraine, it is very, very easy for it's easy for you to understand what your migraine can be, because of, if you just slightly go back and ask these questions to yourself, because of which you can find a way and a pattern to choose your next program. Okay, so you can combine migraine with multiple different programs. There is a difference in the program. Insomnia program